Should you be experiencing morning erections? And how often should they happen? I'm Dr. Rena, a urologist and pelvic surgeon. Let's start with the basics. Why do men wake up with an erection at all? Surprisingly, it's not simply because of sexual dreams or thoughts. Morning erections are actually a normal function of the male body. They're known as nocturnal penile tumescence, and they mostly occur during a stage of sleep called REM sleep, which is when most dreaming happens. And REM sleep usually takes place in the early morning hours. That's why many men notice an erection either as they wake up or just after REM sleep ends. Most people can remember their teenage years, when waking up with noticeable morning erections was very common. But what's considered normal after those years? This has actually been researched for decades. One of the earliest studies was done in 1975, where researchers observed 125 healthy males ranging from 3 to 79 years old in a sleep laboratory. They used specialized equipment to track brain activity, eye movement, and changes in penile size during sleep. Each participant stayed in the lab for 3 nights. To ensure accurate findings, researchers focused mainly on the second night's data. They only included individuals who had no sleep disorders, no erectile issues, and were not taking medications that could influence the results. From this, they established baseline data for healthy individuals without underlying concerns. They found that even in early childhood, from ages 3 to 9, erections during sleep already occur and remain fairly steady. As boys enter their preteen and teenage years, this becomes the peak period. Erections happen more frequently and last longer during sleep at this stage. In early adolescence, the average duration of an erection during REM sleep is around 40 minutes. In fact, when you add it all up, erections can occur during roughly 40% of total sleep time overnight. After puberty, the total time spent having erections during sleep begins to decrease and levels off at about 20% of total sleep time, which equals roughly an hour and a half each night, with the average erection lasting around 30 minutes. On average, most men will experience between 3 to 5 episodes of tumescence or erections during the night. Now, you might be thinking that this happens because REM sleep decreases with age, but that's actually not the case. REM sleep stays fairly stable after the teenage years, with most adults getting about 100 minutes of REM sleep each night. A more recent study explored how these nighttime erections change as men get older, using a specialized device that measures nocturnal penile tumescence. In this study, researchers included 40 healthy, sexually active men between the ages of 20 and 60. None of the participants had sexual dysfunction, sleep disorders, or were taking medications that could affect sexual performance. Each participant spent a night in a hospital setting where the device recorded their erections. Even in this newer research, erections were observed in every age group, regardless of age. However, the level of blood flow during these erections did decrease over time. Men in their 20s showed an average increase in blood flow of about 268% of normal levels, while men around age 50 showed about 200%. So while the blood flow remained strong, it was slightly reduced with age. Interestingly, the number of erections and how long they lasted did not significantly change. On average, men experienced just under 4 erections per night, about 3.78, and the longest erection typically lasted around 31 minutes. Other studies conducted since the 1970s have confirmed similar findings in healthy men. So what does all of this mean for you? It means that having nighttime or morning erections is something that should continue even into later life. They tend to be most frequent and longest during the teenage years, and gradually decrease somewhat with age. However, if you find that you're no longer waking up with erections at all, or you rarely notice them during the night, it's something worth paying attention to. There are several reasons for this, right? When you're having healthy nighttime erections, it's a sign that your blood circulation is working well throughout your body. It also reflects balanced hormone levels and proper nerve function, because all of these systems need to be working together for blood to reach the penis. If that blood flow isn't happening as it should, it can be an early sign that something else may be off. You might begin to notice changes in your erections while you're awake, especially during intimacy. Or you may start experiencing other symptoms, such as those linked to low testosterone. So, if you're noticing these changes, the first step is to check your testosterone levels, since they are closely connected to nighttime erections. In some cases, a drop in testosterone shows up first as a decrease in these erections. It's also important to take a step back and evaluate your overall lifestyle, because improving blood flow and general health is key. This means maintaining a healthy weight and staying physically active. Regular exercise should include both strength training with weights and aerobic activity each week to support circulation and hormone balance. In addition, managing stress and getting quality sleep are just as important. All of these factors work together to improve blood flow, support reproductive health, and benefit your overall well-being. The bottom line is this: morning erections are an important indicator. They act as a marker of your overall health. If you notice they're becoming less frequent, it's a signal to pause and consider what changes you can make to improve your health. As a bonus, they can help you spot potential issues early, before problems like erectile dysfunction or other concerns develop. So think of it as your body's way of giving you useful feedback. And as always, remember to take care of yourself, because you truly matter.